Have you been wondering what in the world they mean by the donut hole in Part D? Exactly what is that all about? And why would they put a big old donut hole in the middle of your drug plan anyway? Hi there, if we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits, where we help baby boomers with their Medicare Part D drug plans and supplemental coverage. In this video, I'm going to explain what the Medicare Part D donut hole is and why it exists. Stick with me to the end and you'll find out how you can get our best tips for reducing your drug expenses. So why does Medicare Part D have a coverage gap? In 2006, when Congress created the Part D program, they needed to find a way to get millions of Medicare beneficiaries on board with using generic drugs whenever possible to reduce the cost of the Part D program as a whole. You see, something a lot of Medicare beneficiaries don't realize is that the monthly premium you pay for Part D doesn't even begin to cover the medications used by the average person on Medicare. Many drug plans out there have premiums under $30 a month. If you take even one brand name medication, that monthly premium you're paying for Part D is likely less than the retail cost of just that one medication, let alone enough to cover several medications. So folks, it's important to understand that the Part D program isn't funded by your premium dollars. Instead, it's mostly funded by dollars that come directly from Medicare, and it's Medicare's goal to keep the cost of the Part D program as low as possible for the national budget. If every beneficiary went out and filled brand name medications all year long, the cost of the Part D program would quickly become unsustainable for the nation. They needed a way to encourage you, the Medicare beneficiary, to use generic drugs whenever possible, and that's exactly what the donut hole is all about. It was designed to make you pay more for your medications if your drug spending goes over a certain limit each year. Here's how it works. Every time you fill a prescription, Medicare tracks the total cost of that drug, and if the cost of your medications goes over a certain dollar limit in a calendar year, then you hit the coverage gap or donut hole, and the price of your medications goes up. When the program was first created, people paid 100% of the cost of their drugs when they were in the gap. And this system by and large worked because anyone who could take generic drugs definitely did to try to stay under that dollar limit and out of the gap. However, there are a number of medications out there that are still under patent and there's not a generic equivalent available. So the coverage gap was still a great hardship for these people who would hit the gap and then find themselves paying hundreds of dollars, sometimes for just one medication. Fortunately, some additional legislation has slowly reduced the cost of your brand name drugs in the gap from 100% back in 2006 to just 25% this year. So why is it that you sometimes still see a difference in the amount you pay for a certain drug before the gap and the amount you pay during the gap? The answer is that many drug plan insurance companies actually exceed Medicare's minimums during the initial coverage level, which is the period that happens just before the gap. The plans can cover more than 75% of the cost of the drugs during the initial coverage level, but then when you hit the gap, they revert back to paying just 75%. So you still see a hike in cost during the gap. Here's an example. Let's say you have a brand name drug that falls into Tier 3 and on your plan that has a $50 copay. During Stage 2, the initial coverage level, the plan will just collect the $50 from you. However, when you hit the gap, the plan can now change to charging you 25% of the cost of the drug. If your medication has a retail cost of $400, your 25% coinsurance in the gap is $100. So you will see your share go from $50 to $100 when you hit the gap. The bottom line, it's never fun to pay more for your meds in the gap. However, it's better than what people paid in the early years of Part D and far better than what people paid prior to 2006 when there was no drug coverage in Medicare at all. You can plan for your gap spending each year by using Medicare's Plan Finder tool to shop for the most cost-effective plan. Medicare's tool will give you an estimate of what you'll spend on your medications before the gap and what you'll spend during the gap. Remember too that if you have your Medigap or Medicare Advantage policy through our agency, here at Boomer Benefits, we'll run that analysis for you each and every year for free. This is very important because the premiums, copays, and benefits on your current plan change every year. We can analyze whether another plan may be more cost effective for you the next year. Now that you know why Congress created the coverage gap, do you have any questions about how the gap may affect you? If so, put them in the comments below and my team and I'll be happy to answer. You can also get our tips about reducing drug expenses by visiting the Part D plans page on our website. I'll drop the link in the comments below. And if you haven't yet subscribed to our channel, please hit the red subscribe button so you'll always be notified whenever we drop a new video here on our channel just for you. Thanks for watching, and we'll see you in the next video.